That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with a doctor. You now have 90 seconds to read questions 31 to 36.
Today we are talking to Dr. Jessica Kim, a cardiologist and expert in angina pectoris in the USA. Dr. Kim, can you explain what angina pectoris is and what causes it?
Angina pectoris, commonly known as angina, is chest pain or discomfort that occurs when the heart muscle is not getting enough blood and oxygen. This can be caused by a blockage or narrowing of the coronary arteries due to the buildup of plaque or cholesterol.
How is angina diagnosed and what are the symptoms?
Symptoms of angina typically include a feeling of pressure or tightness in the chest, shortness of breath, and pain that may radiate to the neck, arms, or back. Diagnosis is typically made through a combination of physical exams, medical history, and diagnostic tests such as an electrocardiogram, ECG, or stress test.
What treatments are available for angina?
Treatment for angina typically involves lifestyle changes such as quitting smoking, increasing physical activity, and managing stress. Medications such as nitroglycerin or beta blockers may also be prescribed to help manage symptoms. In some cases, procedures such as angioplasty or coronary artery bypass surgery may be necessary to improve blood flow to the heart.
Are there any long-term complications associated with angina?
If left untreated, angina can lead to more serious conditions such as heart attack or heart failure. It's important to diagnose and treat angina as early as possible to prevent these long-term complications.
What can people do to prevent angina?
Maintaining a healthy diet, exercising regularly, and managing risk factors such as high blood pressure or high cholesterol can help prevent angina. It's also important to seek medical attention if you are experiencing any symptoms of chest pain or discomfort.
Can you share a case study of someone who has experienced angina?
Yes, I recently saw a patient, let's call him John, who presented with chest pain and shortness of breath. After running some tests, we diagnosed him with stable angina. We started him on medications to help manage his symptoms and recommended lifestyle changes such as quitting smoking and increasing his physical activity. With proper management, John's symptoms improved significantly.
What advice do you have for individuals who may be at risk for angina?
If you have risk factors for angina such as high blood pressure or high cholesterol, it's important to manage these conditions through lifestyle changes and medication. It's also important to seek medical attention if you are experiencing any symptoms of chest pain or discomfort. With proper management, angina can be controlled and the risk of more serious conditions can be minimized.
Thank you for sharing that case study, Dr. Kim. Can you explain a bit more about the different types of angina and how they are treated differently?
Of course. There are three main types of angina: stable, unstable, and variant, also known as Prince metals. Stable angina occurs predictably during physical exertion or stress and is often relieved with rest or medication. Unstable angina is more severe and can occur at rest or with minimal exertion, and requires more urgent medical attention. Variant angina is less common and occurs when a coronary artery spasm restricts blood flow to the heart, and it can also be treated with medication.
That's helpful to know. How do you determine the best treatment plan for a patient with angina?
Treatment plans are individualized based on the patient's specific symptoms, medical history, and overall health. In general, lifestyle modifications such as exercise and diet changes are recommended for all patients. Medications may be prescribed based on the type and severity of angina, and in some cases, procedures such as angioplasty or bypass surgery may be necessary to improve blood flow to the heart.
Are there any new treatments or technologies being developed for angina?
Yes, there are ongoing research and development of new treatments for angina. One exciting area of research is the use of stem cells to promote the growth of new blood vessels in the heart, which could improve blood flow to the heart and reduce symptoms of angina. There are also new medications being developed that target specific pathways in the body to improve blood flow and reduce inflammation in the coronary arteries.
That's interesting. Can you discuss any specific lifestyle changes that can help prevent or manage angina?
Absolutely. Quitting smoking is one of the most important lifestyle changes that can reduce the risk of angina and improve overall heart health. Regular exercise can also improve blood flow to the heart and reduce the risk of heart disease. A heart-healthy diet, including plenty of fruits, vegetables, whole grains, and lean protein sources, is also important. Managing stress through relaxation techniques, such as meditation or yoga, can also be helpful.
That's great advice. Finally, can you discuss the role of family history in the development of angina?
Family history can play a significant role in the development of angina and heart disease. If a close family member, such as a parent or sibling, has had heart disease, it's important to inform your healthcare provider and to manage risk factors such as high blood pressure and high cholesterol. Regular checkups and screenings can also help detect early signs of heart disease and prevent more serious conditions from developing.
Now look at Extract 2. Extract 2. Questions 37 to 42. You hear a talk given by a healthcare professional. You now have 90 seconds to read questions 37 to 42.
Dear friends, I am honored to be speaking with you today about a condition that affects millions of people worldwide. Idiopathic thrombocytopenic purpura, or ITP, is a blood disorder that can lead to bleeding and bruising, as well as other complications. Although the cause of ITP remains unknown in many cases, the diagnosis and management of this condition has come a long way in recent years. The first thing you need to know about ITP is that it affects the platelets in your blood. Platelets are tiny cells that help clot your blood when you cut yourself or get injured in some way. In a person with ITP, their immune system mistakenly identifies these platelets as foreign and attacks them, leading to a deficiency in platelet numbers in the blood. This can make it harder for your body to clot effectively, leading to excessive bleeding and bruising. The symptoms of ITP can vary and are not always present. Some people with the condition may not show any symptoms at all, while others may experience severe bruising or bleeding. Common symptoms include bruising easily, small reddish-purple spots on the skin, nosebleeds, bleeding gums, and blood in the urine or stool. If you have experienced any of these symptoms, it is important to go to a doctor as soon as possible. A diagnosis of ITP may be made after a physical examination and some laboratory tests, including a complete blood count and a platelet count. Some additional tests may also be performed to determine the underlying cause of the condition. One of the most important things to know about ITP is that it can be managed effectively with appropriate treatment. Treatment may vary depending on the severity of the condition and the patient's medical history. For those with mild cases, observation and regular platelet counts may be sufficient. However, for others, medication or other therapies may be needed to manage the condition effectively. Corticosteroids or immune suppressants are typically the first-line treatments prescribed for ITP. They work by reducing inflammation and suppression of the immune system. These treatments have been proven effective in reducing the number of platelet-destructing antibodies, which in turn increases the platelet count. In some cases, immunoglobulin injections or plasma exchange may be used to help replace lost platelets quickly. For those who do not respond to these treatments or who have recurrent episodes, more aggressive treatments may be required. This may include the use of a monoclonal antibody called rituximab, which can help to reduce the number of destructive antibodies in the bloodstream. Additionally, a drug called TPO mimetics can be given as an oral medication to increase platelet production by activating a substance called thrombopoietin, which stimulates the growth of new platelets. There are also things you can do on your own to manage ITP. This includes avoiding activities that can pose a risk of injury or bleeding, taking steps to prevent infection, and getting plenty of rest. A healthy diet that is rich in iron and other essential vitamins and minerals can also help promote good health. I would like to share with you a case study of a patient who was diagnosed with ITP. Sarah is a 35-year-old woman who came to the clinic complaining of easy bruising and small red spots on her skin. She had never experienced these symptoms before and was understandably concerned. Sarah underwent a physical examination, and laboratory tests revealed that she had a significantly low platelet count, leading to her diagnosis of ITP. Sarah's condition was moderate, and treatment was initiated with a corticosteroid. She had few side effects from the medication, and her platelet count gradually increased over several weeks. Sarah was monitored closely with weekly platelet counts, and her treatment was adjusted based on her response. At her 3-month follow-up appointment, Sarah presented with symptoms again, and her platelet count was low. She was started on another medication, a thrombopoietin receptor agonist, which stimulated her body to produce more platelets. Her platelet count began to increase within days of starting the medication, and she continued to take it for several months until her platelet count was stable. Sarah was also advised to avoid activities that could lead to injury or bleeding and was counseled on how to manage bruising and bleeding episodes. She was encouraged to take precautions and seek medical attention if she experienced any significant bleeding. Current research has focused on identifying genetic and environmental factors that may contribute to the development of ITP. Studies have also looked at the use of novel therapies, including the development of new drugs that target specific immune cells involved in the disease. Future directions for treatment of ITP may include the use of precision medicine, which involves targeting therapies based on an individual's genetic makeup and disease characteristics. This approach has shown promise in other blood disorders and may prove effective in treating ITP. In conclusion, ITP is a complex blood disorder that can be managed effectively with proper diagnosis and treatment. Patients with ITP can lead normal, healthy lives with appropriate management and medical care. We must continue to invest in research to better understand this disease and develop more effective treatments for those who live with it. Thank you.
That is the end of Part C. You now have 2 minutes to check your answers. That is the end of the